As the population continues to age, the need for medical care goes up, but it's coming at a time where there's a shortage of doctors. News 8's Pauline Lee joins us live in the studio with what we're seeing locally.
Well, our hospitals have been trying to combat the shortage for the past few years, but that may not be the only change they're facing. The evolving model of patient care could play a big role in how many doctors are needed in the future.
Finding replacements for retiring physicians hasn't really been a problem at Gunderson Health System.
We have historically been able to recruit enough to replace that number and also grow small incrementally above that.
But it's becoming increasingly difficult as the number of retirees grows and the talent pool dwindles.
There certainly is fewer people, fewer physicians available for the talent, simple supply and demand right now. There's more people retiring and fewer coming into the equation.
A new study from the Deloitte Center of Health Solutions suggests more doctors will retire earlier than usual in the next few years. Nevela says Gunderson's recruiting process has changed in order to compete with the same shortage seen around the nation, mainly in primary care for rural communities.
We've typically recruited them about a year in advance of their graduation. These days, we're seeing that process be pushed out to 2 to 4 years.
David Rushlow from Mayo Clinic Health System says there may be a better way to care for patients.
We may not be able to supply that total need in the current model, but in the future model, in that concept of teams, professions such as nurse practitioners, physician assistants will be used more to help take care of that.
Rushlow says physicians working in teams is being used in many hospitals across the nation. It's also being piloted at Mayo. While it's still uncertain if this model is the route all health organizations will take in the future, Rushlow says what's important is what's best for the patient.
And now the study also suggests some trade-offs with the future teamwork model for patient care. It says some physicians are concerned about losing their independence and their personal relationships with the patients. At the same time, physicians also gain a network of expertise and help.
All right, thank you, Pauline. Along with longer recruiting process, Gunderson has also provided more incentives to attract more recruits, including student debt relief.